Every single night, 90 million adults in North America go to sleep and stop breathing. Not once, but dozens of times, sometimes hundreds. Their partners lie awake, listening to the silence between snores, waiting for the next breath, wondering if this time it won't come. And the person doing the snoring, they have absolutely no idea that every single episode is causing microscopic damage to their heart that accumulates night after night, year after year, until one morning they wake up with chest pain that changes everything. I'm going to tell you something that most sleep specialists won't mention in a standard consultation. Snoring is not a noise problem. It is not about disturbing your partner. It is a cardiovascular emergency happening in slow motion, and the damage is measurable, documented, and in most cases completely reversible if you understand what's actually happening inside your body. Subscribe to Dr. Waterling right now and hit that like button. We're working toward building this channel on one principle: real solutions that cost nothing, require no prescriptions, and give you back control over your own health. Every subscriber tells me there are still people who want the truth instead of the sales pitch. Most people think snoring is about the throat, about relaxed tissues vibrating during sleep, maybe weight gain, maybe age, maybe just bad luck. That's not wrong, but it's less than half the story. What's actually happening is a mechanical failure that creates a pressure differential inside your chest cavity that your heart was never designed to handle. Let me explain exactly what that means. When you fall asleep, muscle tone throughout your body decreases. That includes the muscles in your throat, your tongue, and the soft palate at the back of your mouth. In someone who snores, those tissues relax enough that they partially block the airway. Not completely, or you'd wake up immediately gasping for air. Just enough to narrow the passage. Now here's the physics of what happens next. When you try to inhale through that narrowed airway, your diaphragm contracts harder to pull air through the restriction. That creates negative pressure inside your chest, like sucking through a straw that's been pinched nearly shut. Your lungs are trying to expand, but the air can't get in fast enough, so the pressure inside your chest cavity drops dramatically. That negative pressure does something dangerous. It pulls on the walls of your heart. Your heart sits inside your chest cavity, surrounded by this pressure environment, and when the pressure drops, the heart chambers expand more than they should. The right atrium, the upper right chamber of your heart that receives blood returning from your body, stretches under this abnormal suction. In medical terminology, this is called increased transmural pressure. Trans means across, mural means wall. The pressure difference across the heart wall increases. Do this once or twice, your heart recovers. Do this 30 times an hour, every hour, for 8 hours, for years, and you're looking at permanent structural changes to the heart muscle itself. Research published in the European Heart Journal tracked 500 adults who snored regularly for more than 5 years. The findings were unambiguous. Snorers showed measurable thickening of the left ventricular wall, reduced ejection fraction, meaning the heart couldn't pump as efficiently, and a 67% higher rate of atrial fibrillation compared to non-snorers of the same age and weight. That's not correlation, that's documented cardiac remodeling. The system you rely on for your health is not built to prevent this. It's built to treat you after the heart attack, after the stroke, after the diagnosis of congestive heart failure. There's no billing code for teaching you how to sleep in a position that keeps your airway open. Your next appointment will not include a 20-minute explanation of sleep mechanics and gravity's effect on soft tissue positioning. I've seen this pattern hundreds of times in clinical practice. A patient comes in complaining of morning headaches, daytime fatigue, difficulty concentrating. They mention almost as an afterthought that their spouse says they snore. When I ask how long, they shrug. Years, maybe a decade. They've tried everything. Nasal strips that do nothing. Throat sprays that taste terrible and accomplish less. Expensive mouth guards that hurt their jaw. Separate bedrooms. And when they finally mention it to their doctor, they get a referral for a sleep study that costs $3,000, takes 6 months to schedule, and ends with a prescription for a CPAP machine they'll abandon in a closet after 3 miserable weeks. Let me tell you about Richard, 58 years old, software engineer, came to see me after his wife threatened to move to the guest room permanently. He'd been snoring for 12 years. Not occasional snoring, every single night, loud enough to be heard through closed doors. He'd tried nasal strips, elevation pillows, even one of those chin strap devices that's supposed to keep your mouth closed. Nothing worked. His wife recorded him one night on her phone. The recording showed something terrifying. Periods of loud snoring interrupted by complete silence lasting 15, 20, sometimes 30 seconds, followed by a gasp and immediate return to snoring. That's sleep apnea, the complete closure of the airway, and Richard had no idea it was happening because the brain doesn't fully wake you during these episodes. You shift just enough to restart breathing, then drop back into disrupted sleep. You wake up exhausted without knowing why. I asked Richard one question: what position do you sleep in? He looked confused. On my back, he said. Always have. That was the problem. That single position was destroying his sleep, stressing his heart, and setting him up for serious cardiovascular disease within the next decade. Here's what nobody tells you about sleeping position and airway mechanics. Gravity is not neutral. When you lie on your back, gravity pulls your tongue backward toward your throat. It pulls the soft palate down. It allows the tissues at the back of your throat to collapse into the airway space. If you're over 50, if you've gained even 10 pounds since your 30s, if you have even slight age-related muscle tone loss, that's enough to create significant airway narrowing. Now turn on your side. Immediately, gravity changes direction. Instead of pulling your tongue back into your throat, gravity pulls it to the side, against your cheek. The soft palate hangs to the side instead of down. The airway stays open. It's not complicated medicine. It's basic physics applied to anatomy. A study published in the Journal of Clinical Sleep Medicine compared the same individuals sleeping on their backs versus their sides. On their backs, they averaged 42 apnea episodes per hour. On their sides, that number dropped to 6. Same people, same night, different position. The reduction was immediate and required zero medical intervention, zero equipment, zero prescriptions. But here's the problem. If you've spent 40 or 50 years sleeping on your back, your body will roll back to that position unconsciously during the night. You start on your side, you wake up on your back. I've heard this complaint 1,000 times. I can't stay on my side. I've tried. I always end up on my back by morning. There's a solution, and it costs approximately $2 and takes 30 seconds to set up. You need one tennis ball and one old t-shirt you don't care about. Take the tennis ball and place it inside a sock or sew it into a small pocket on the back of an old t-shirt right between your shoulder blades. Put the shirt on backward so the ball sits against your spine in the middle of your upper back. Now try to lie on your back. You can't. The ball creates just enough discomfort that your body won't stay in that position. This is not theory. This is a documented clinical intervention called positional therapy, and it works. The discomfort is not painful. It's not keeping you awake. It's just enough to prevent you from rolling onto your back unconsciously. Within 3 to 5 nights, most people stop trying to roll back at all. Your body adapts. You become a side sleeper. Richard tried it. The first night, his wife reported the snoring reduced by half. Still there, but noticeably quieter and less frequent. The second night, she said she actually slept through the night for the first time in years. By the end of the first week, Richard's snoring had dropped to occasional light breathing sounds. No more gasping, no more silence, just normal breathing. He came back 6 weeks later for a follow-up. The change was obvious. His face looked different. Less puffy, less gray. He said his morning headaches were gone. His energy had returned. He'd lost 4 pounds without changing his diet, which makes sense because sleep deprivation disrupts leptin and ghrelin, the hormones that regulate hunger and satiety. Better sleep equals better appetite regulation. But the most important change was invisible. His heart was no longer experiencing those repeated episodes of negative intrathoracic pressure. The strain on his cardiac muscles stopped. The risk of atrial fibrillation, of ventricular hypertrophy, of eventual heart failure, all of it significantly reduced by one absurdly simple position change. Now let me be very clear about something. If your snoring includes witnessed breathing pauses, if your partner reports that you stop breathing and then gasp or choke, if you wake up gasping for air, if you experience extreme daytime sleepiness where you're falling asleep during conversation conditions or while driving, that is severe sleep apnea, and it requires medical evaluation. You need a sleep study. You may need CPAP therapy. Positional therapy helps, but it does not replace medical treatment for severe obstructive sleep apnea. The tennis ball method works for positional snorers, people whose snoring happens primarily or exclusively when sleeping on their back. If you snore in all positions, that indicates more significant airway obstruction that needs professional assessment. But for the majority of snorers, the ones whose partners say the snoring stops when they roll you onto your side, this intervention can be life-changing, and it addresses something that medical appointments often miss. The cumulative cardiac damage from years of snoring is real, measurable, and progressive. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it directly shapes what I cover in future videos. If you're over 50 and you snore, you are in the highest risk category for cardiovascular complications from chronic sleep-disordered breathing. Here's your complete protocol. Tonight, before you go to bed, take a tennis ball and place it in a sock. Tie the sock closed or use a safety pin to secure it to the back of an old t-shirt at the level of your shoulder blades. Put the shirt on backward. Sleep on your side. If you naturally prefer your right side, sleep on your right. If you prefer your left, sleep on your left. The important thing is not which side, it's that you're not on your back. For the first 2 or 3 nights, you may wake up briefly when you try to roll onto your back and hit the tennis ball. That's normal. Your body is learning. By night 4 or 5, you'll stop trying. By week 2, you can remove the tennis ball and test whether you stay on your side naturally. Most people do. The habit has formed. If you're sleeping with a partner, tell them what you're doing and why. Ask them to observe and report changes in your snoring patterns. Their feedback is more valuable than anything you'll notice yourself because you're unconscious during the problem. In addition to position change, there are 3 supporting factors that reduce snoring severity. First, avoid alcohol within 4 hours of bedtime. Alcohol relaxes throat muscles even further, worsening airway collapse. Second, if you're overweight, even a 5 to 10 pound reduction can significantly decrease soft tissue bulk in the throat. You don't need to achieve ideal body weight. Even modest loss helps. Third, sleep with your head elevated 30 to 40 degrees. This doesn't mean piling up pillows under your head, which actually kinks your neck and worsens the problem. It means elevating the entire upper body by placing blocks under the headboard legs or using a wedge pillow that supports from your hips to your head. The combination of side sleeping, modest weight reduction, alcohol avoidance, and upper body elevation can eliminate snoring entirely in a significant percentage of cases. No devices, no prescriptions, no surgery. Just applied understanding of mechanical airway dynamics. Now, let me address the question I know some of you are asking. What about those mandibular advancement devices, the mouth guards that pull your jaw forward? Do they work? Yes, for some people. They hold the lower jaw forward, which pulls the tongue forward, which opens the airway. But they're expensive, often $500 to $2,000 for a custom-fitted device. They cause jaw pain, excessive salivation, and tooth movement in many users. And most people abandon them within 6 months. Compare that to a tennis ball in a sock. Free. No side effects. Effective in days. The choice seems obvious to me. What about surgical options? Uvulopalatalpharyngoplasty, the removal of tissue from the back of the throat, has a success rate of approximately 40 to 50% and comes with significant pain, recovery time, and risk of complications, including voice changes and swallowing difficulties. It's a last resort for severe anatomical obstruction, not a first-line intervention for positional snoring. The healthcare industry profits from complex interventions, not from teaching you to sew a tennis ball into a t-shirt. There's no revenue model in empowering you to solve this yourself. That's why this information doesn't come up in a 12-minute office visit. That's why you're learning it here instead of from the specialist you waited 3 months to see. If this video helped you, send it to someone you care about, a spouse, a parent, a friend who snores and doesn't realize they're slowly damaging their heart. You may have just given them years of life they would have lost to preventable cardiovascular disease. Subscribe to Dr. Waterling and hit that notification bell. We're building something different here. No sponsors, no supplement sales, just information that works, delivered to people who deserve to know it. Every subscriber moves us closer to reaching the audience that needs this most. Your heart doesn't care whether you believe this works. The physics doesn't change based on your skepticism. The pressure differential inside your chest cavity when you snore on your back is measurable, documented, and damaging. The solution is free, immediate, and effective. The only question is whether you'll actually do it tonight instead of waiting until the morning you wake up with chest pain and wish you'd acted sooner. You are not helpless in front of your own biology. Your body is not broken. Your airway is responding to gravity exactly the way physics predicts. Change the position, change the outcome. It's that simple, and it starts tonight.